Hi, I'm Juan Trevino, and I'm one of the licensed mental health clinicians here at Daybreak Health. I know a lot of you haven't heard of Daybreak Health before, so I really wanted to give you an introduction about who we are. At Daybreak Health, we partner with schools to provide mental health services to their students. Typically, the kids that we work with have some mild to moderate challenges with things like anxiety, depression, grief, stress, trauma, stress related to the pandemic, and we work with them through a one-on-one virtual telehealth model that makes it really easy to access us. Now, you might wonder how your child gets referred to Daybreak Health. Now, if a staff member at your school thinks that your student would benefit from some additional support, they can refer your child to our program. Now, after this referral takes place, your child will have a video intake appointment with the Daybreak specialist to help assess the types of needs that they have. And as we learn about them, we learn about what preferences they might have and really work hard at matching them with a clinician that's going to build a strong therapeutic alliance, giving us better outcomes on the goals and interventions we're trying to facilitate. For example, your child might have a clinician that speaks a particular language or who comes from a specific cultural background. They might have certain interests or hobbies that are relatable to their clinician. And so we really take our time to match them with the therapist that's going to be the best fit for them. Because of this, over 90% of students that work with us say they're satisfied with their therapist. But if for some reason, whatever reason, your child doesn't connect with their therapist, we can help rematch them with a new one. Now, once they're matched with a licensed therapist, that typically takes about 3 to 5 days. Daybreak is going to communicate with school staff and family to facilitate check-ins throughout the 12-week program. We're going to provide updates on what we're working on and how adults can continue to support their child, but we also really want to respect the fundamental confidentiality of our therapy sessions. Now, during the program, if your child has a hard day or has questions, they can also message their counselor directly through our Daybreak app. This gives them some additional support in between sessions. Most of the time, students develop skills they need to manage their symptoms in the future. But if the 12-week program isn't enough and the Daybreak counselor thinks that your child could use continued support, we're going to work with your family and school to find ongoing resources that help provide continuing care for your child. Our program is sponsored by school districts. And if you're not sure if your district is sponsoring Daybreak, I would recommend that you reach out to your school principal or administrator to find out. Students can also do their therapy sessions at home or at school, both during and after school hours. We can work with your student on the weekends or during the week, and we really work hard to provide these services not only during school, but also during summer and during holiday breaks, really working with students to meet them where they're at. Now, the Daybreak team is also always available to ensure that your student and family are having a seamless experience. From intake to first session to check-ins to discharging, the team is going to communicate and serve as a key contact throughout it all. I hope that getting some of this information is helpful for you, but before you go, I have to tell you how happy both students and parents have been working with Daybreak in our model. 98% of students we work with report that their therapist provided them with the tools and support they need to improve their social and emotional health. And 98% of parents are reporting behavioral improvements in their child. If you have any questions about our services, about Daybreak, I really encourage you to reach out to hello@daybreakhealth.com. Again, that email address is hello@daybreakhealth.com. And we're here for you and your family. Thanks so much.